Good day, good afternoon, good evening. My name is Dr. Aunjuli, and Live in Your Truth Talk, where in a few minutes we help you live in your truth and change your life. Heart disease, cancer, stroke, diabetes, arthritis, Alzheimer's, lung disease, kidney disease, COPD, cystic fibrosis, lupus, HIV, and many more that fall into the category of chronic illness and pain. One day, you wake up and you feel something is not quite right with your body. You go to the doctors, and suddenly you have a diagnosis of a chronic illness or some form of chronic pain. Chronic illness comes on suddenly at times, and then it lasts sometimes for the rest of your life. And what is the emotional and psychological implications of that happening to you? Well, first, you may feel fear and sadness and anger about being diagnosed with such an illness or pain. Why is this happening to you now? It might be occurring in the prime of your life. Perhaps you just got a new job. Perhaps you just got married. Or you're pregnant. Or you just have something wonderful that just occurred in your life and you're celebrating it. And suddenly you find out this chronic illness or this chronic pain is now a part of your life on the long term. So, you might begin to do some things differently, emotionally and mentally, such as isolating yourself socially from others. You begin to feel low self-esteem and feeling lonely. You don't really want to be around other people. Maybe you're afraid of having an episode or afraid of letting other people know that you have this illness that reoccurs. So you isolate yourself. You don't go out as you used to. You don't socialize. You withdraw. You also begin to have worries and fears. You're wondering about the long-term effects and the hospital visits that you may have to go through, or medical procedures that may happen, or the medication that you might need to be on for a very long time. You also sometimes might feel out of control and a loss of independence. You control your life, and now suddenly you don't anymore. It's hard to make that adjustment and change the way you do things. You can't move quickly as you used to. You can't be as active as you want to be because of your illness or pain. And then there are times where some become anxious and depressed because not only does your chronic illness impacts you physically, but it also impacts you spiritually. You start questioning your life and what you're doing here and your purpose. And because chronic illness can impact you physically, it leaves you sort of in the unknown about the future. You have a job, now you have to tell your employer that you might need some accommodations, or you need to take certain time off For some, it makes them feel weak. It makes them feel no one really understands what they're going through. Other times you will feel discouraged after having an episode. Say you had a heart attack, or you have received a cancer diagnosis. You may not feel like life is worth going on and moving forward. Chronic illness can include so many different implications of fatigue and discomfort, pain, hopelessness, irritability. You also may experience the lack of empathy and understanding from others, discrimination, even some stigma. You might find that the medical providers that you have may not be as understanding, and so now you have to find a new medical provider or providers that is going to be a part of your team that really cares about your well-being. And then you will also worry and sometimes become stressed about dealing with your flare-ups, your tests, and your treatments. You get tired of having to go to the doctors all the time, tired of getting blood work done, tired of talking about the same thing over and over again. One medication works, now it doesn't anymore, now you have to take another. Or the medication that you have has side effects, and so now you're taking something else to help with the side effects. And the tests that you have to go through, the x-rays, the CT scans, the MRIs, getting poked and pricked. You feel alone. You feel that no one really truly understands or cares about what you're going through. However, there is hope. And that hope comes from learning to understand and accept what is happening to you, so you do not allow it to be part of what fulfills your life completely. So it's about learning to acknowledge and tolerate the difficult thoughts and feelings and sensations of your chronic illness and your pain. It's about separating yourself and learning to separate yourself from those negative thoughts and seeing the thoughts as facts. This is what it is. This is all it is. It's about learning to be mindful and in the present moment, to have the ability to be fully aware of what is in front of you and what's going on now, without worrying about what happened to you then and what could possibly happen to you in the future. To not get caught up in that. It's also about awareness of oneself. What you say, what you do, how you behave, your feelings. And rather become an observer of your thoughts and feelings. Seeing things for what they are without judgment. To not judge your thoughts, not judge your feelings, to not judge your behavior, your attitudes, to understand that you're not supposed to be perfect, that you are supposed to just be you, and you should be at your best, and to embrace that your best is going to look differently when you're well and when you're not well, and to not judge that and to accept. Also, it's really about taking action as well that is in line with your good, positive values and beliefs. That value that motivates you to have self-worth and self-esteem. The things that I've just spoken about can help you reduce anxiety and depression, and it can also help reduce some of your chronic pain that you have. It can also help you walk with your chronic illness instead of your chronic illness walking you. That it's okay to sometimes not to feel at your best, to accept that as your present if it's happening now, but when it's not, to go and live your life to the fullest, participating to the best of your ability, and to not be scared. When you're feeling overwhelmed, my friend, when you're feeling that you can't go on, when you're so depressed that you've isolated and withdrawn yourself from the world, and you may even sometimes have thoughts of not wanting to be here any longer, remember, you are not your thoughts or feelings, but rather an observer of your thoughts and feelings. And try to witness or be a witness to your own life, watching yourself moving through life, through your chronic illness, through the pills that you take, through walking slowly in the pain. Now, some of you may not even know what your values are, but I will tell you this: once you know, you'll know how to take action. So when you start to struggle, you'll begin to be able to change your life and become committed to setting goals towards when things are difficult, so you can live a more fulfilling life. My name is Dr. Aunjuli, and Living Your Truth Talk. I hope that my words encourage you to live in yours. And if you like what you hear, please take a moment to subscribe.